We can hear.
Robbyn.
Yep, I can hear you.
You can hear me? Oh, good. Wonderful. Okay.
You should be up as a panelist, so you should have all of the capacity.
Yes.
Okay, perfect. Well, welcome everybody. It's 12 and we have quite a bit of great material today, so I'm just going to jump right in. And I have an incredible set of headphones that the delegate convinced me to get, and I don't have them on me today. So sound quality will be slightly subpar on my end, but I do have the technology, so I look forward to getting better at having it and using it.
Great. I believe in you.
Thank you. So we'll get started with, I think, the fifth part of our installment series on Environmental Justice 2019 session. Today's webinar is on statewide energy choice and community health, which is sort of a long way of talking about importance of natural gas infrastructure. My name is Tamara Tolles-O'Laughlin, and I'm the Executive Director of the Maryland Environmental Health Network. We're based out of Baltimore, but we work the entire state, and if you need to reach me, there are more than several ways to do that. I am one of the members of the Environmental Justice Legislative Team, and the network is just one of the two facilitators and co-chairs. We participate in the Environmental Justice Legislative Team along with Clean Water Action, who will be hosting next week's the next installment on the 5th on everything you need to know about water and policy related to it. The Environmental Justice Legislative Team works together to magnify community voices through the legislative process to address inequities in Maryland specific to the environment. We are an open group and we welcome participation from anyone who's interested in a more inclusive and equitable landscape in Maryland. Some of our founding members include Blue Water Baltimore, the Beloved Community Church in Accokeek, Chesapeake Physicians for Social Responsibility, Chiefba, Maryland, Interfaith Partners for the Chesapeake, the Maryland chapter of the Sierra Club, as well as the League of Conservation Voters. Again, feel free to join us because we get a lot done for a small group. The network itself has a few guiding principles. Our mission is to promote the elimination of environmental threats to human health, and our vision is one where your address, occupation, social class, status, and zip code are no longer determinants of your health in the state of Maryland. And we work to level the playing field for vulnerable populations by connecting environmental champions that include legislators, health advocates, and communities who are themselves impacted by these issues. What we're going to cover today isn't that different than what we do every single day, but we're doing it with some really great partners. We'll be talking about the public health lens and why a public health organization is focused on statewide energy choice. We'll be talking to folks who are impacted and working on developing solutions. And we will end with a discussion of proposals and bills on point, along with emerging ideas that will deal with some of what has been presented as the problem happening in the state of Maryland. And then we'll close out with basic announcements from participants and information on the next webinar. So just to briefly introduce our partners, Dr. Ann Bristow is here with us today from Frack-Free Frostburg. Can't say that 3 times fast. And the Maryland Community of Communities. She is a fearless advocate who steps out of the classroom every single day to make sure that community health is discussed, is a part of policy that gets built, and a science-based approach to dealing with these issues isn't just a talking point. There's so much more that I could say about her, but she will give you just a snippet of what she's been working on and has been working on since 2013 when she first started on the Marcellus Shale Advisory Commission on these very issues. She is a deep thinker on how human health impacts statewide energy choice, and I am thrilled that she's here with us today. One of our other partners is Kelly Canvan of Amps Creek Council and of Maryland Community of Communities. Their mission is to bring together communities inside of Charles County. So Mattawoman, Piscataway Creek, and Accokeek communities. They work on protecting the environment and ensuring the sustainability of natural resources, because apparently clean air and clean water has to be amplified as a basic human right. She's a person who smiles a lot when sad things are going on, who has lots to add in terms of the color and the texture of how natural gas infrastructure is failing people every single day in our communities. And she shows up with a lot of really poignant strategy and incredible tactics to get people who are not invited into the conversation into spaces where decision makers make generationally important decisions about what's happening in her community. So thank you for joining us, Kelly.
Thank you.
Our final panelist is Delegate Robbyn Lewis, who will join us towards the latter end of the discussion to talk about what she's doing to connect some of this work and develop health impact assessment proposals so that the issues that communities are raising do not fall on deaf ears as we think ornamentally about the environment instead of practically. And we may have, we may be joined a little bit later by another member of Communities, Mr. Len Zuza, who will talk to us a little bit about his strategies to think about community science for air quality measures as a way to think about how we are structuring solutions in the policy space and just to have the best science to respond to community concerns around natural gas infrastructure. So why a focus on natural gas infrastructure for a public health organization? Because the environment impacts all of our health. Climate change is sort of an umbrella term that we use to talk about how all of the triggering events in extreme climate are impacting communities, but everyday versions of that, of how those impacts show up, include air pollution, inadequate water and sanitation, chemical protections, and undue exposure to communities who neither know about it or know how to resolve these issues. Radiation, community noise, occupational risks from entire industries that show up in people's front and backyard, agricultural practices, and anything we put into the built environment tends to impact communities. And because we care about vulnerable populations, it's our prerogative to interrogate trends at that level to find out why what's happening around us ends up within us, and why not all of our communities are responding equally or has the same ability to thrive with the amount of resources that Maryland has at its disposal. So our goal is really simple and very complicated: to lower the likelihood of untimely death and sickness while helping Marylanders achieve the ability to have positive and meaningful lives of their own making. We are not interested in dictating what people do with them, but we think it's only fair that folks have the right to have the same have a playing field that gives them the opportunities. We focus through our work on dealing with social isolation as a determinant of health, because it isn't just what shows up in your backyard, but how it makes you feel personally responsible, endangers your ability to create and maintain wealth, and undermines your health overall by creating a universe where you don't have resiliency. And we are excited to work with our partners on thinking about community as a real force up against this kind of isolation and the harms that come along with it. So why energy choice? Because what we promote or what we devalue impacts the health of generations of Marylanders. If we want to get really technical, it impacts the ones who are here, and it can impact the ability to create new Marylanders. And if you are lucky enough to make a human being, what the stress that you carry into your everyday life can impact the way your genes are expressed and therefore impact the future of Maryland. So what we use as fuel, where and how we look for it, the ways we access it, how we refine it and transport it, has direct and indirect impacts on the human health of everyone in Maryland. We are specifically focused on inclusion because directly impacted communities being involved in the decision-making process actually improves those processes and the outcomes for everybody, as well as increasing agency and resiliency for the residents that are involved. It improves the quality of decision-making and is a benefit to people who build these things, to folks who have to deal with policy, to state-level agencies, and to communities who can realize real benefits from being involved in a process and determining what their stakes for engagement will be. So we hear a lot from the folks that we work with in community about threats. Some of the threats that we'll hear more about today include the proximity of communities to industrial activity, noise, light, air, and water pollution, and the rise of fossil fuel infrastructure, and specifically natural gas infrastructure. So we'll talk a little bit more about how this impacts communities who aren't considered, how their wealth or lack of wealth is not considered, and how a lack of agency for communities within the footprint of all we're going to discuss has real harmful impacts to those groups. We'll also talk a little bit about how a loss of community a loss of community is a real harm to communities who find themselves having their front and backyards chopped up by people who do not even live where they live, who do not experience the impacts of what is happening, and why that is a real blow to community and damages what we should all be fighting to protect. We're also concerned about extreme climate, the lack of state and local health data that responds to communities' clearly articulated concerns about their health, and the non-existent local data that fails to protect residents from these harms as they crop up. So we're also focused on solutions. We're curious and continuing to ask about why statewide energy choice fails to consider vulnerable populations, and why we make large-scale investments in the state without asking the folks who will be impacted what they think. We are here to support communities that demand the end of energy choice that exaggerates existing inequities. And support is one of the things we are most focused on. We're here to support communities that demand state and local health agencies respond to their concerns, and to support the use of local data to make the case that a thing is in fact happening. So what's the impact of natural gas infrastructure on community health? The best way to think about that is to hear from a community member that's dealing with it, that's focusing on it, and has been thinking about it a lot. It's my pleasure to introduce Dr. Ann Bristow. I'm gonna hand the mic over to you.
Thank you. And Tamara, you can go ahead and progress a few more slides. Thank you so much for this opportunity to speak with you. You could stop there. So Tamara has already alluded to the ways in which these issues are interconnected. Natural gas, which is not so natural, and I'll describe why, not only is affecting the communities at the point of extraction and the points of delivery, it's also heating up our climate. And the most recent IPCC report is showing that these short-lived climate pollutants like methane are much more potent than CO2 in the short term, and we don't have much but the short term to deal with this. The primary sources of methane are energy, agriculture, and waste. And I'm going to focus on energy, not that the others aren't important, and not that they aren't also interconnected. Next slide. So methane is the primary ingredient in natural gas. It's most of what is in there, but it's not all of what's in there. There are also, you've heard of propane, because some of you cooked with propane. There's ethane, there are heavier hydrocarbons, there's nitrogen, carbon dioxide, hydrogen sulfide, which is pretty dangerous, and several of these will increase ozone. And this slide shows you the variety of places that it's being emitted. And I read an analysis by a Canadian economics researcher, Dana Scott, who talked about pipelines delivering environmental injustice by changing the physical properties and configurations of communities and taking away community choice for the type of energy in which they want to invest. So what are these natural gas pipelines? I don't know why my slide's doing that. They're delivering pollution, not just methane. They are a material flow of contaminants that engage communities, as I said, at both the beginning, at extraction, and the end. And it's durable. It cements a community into the effects, the health effects that we're going to talk about. And as Tamara's mentioned, they're intergenerational. They're going to stay there. These pipelines that are being built now are going to be there at least 40 to 70 years. The ones we're dealing with now are at least 70 years old. Next slide. So all of the structures leak, and I wanted to share with you that besides the transmission lines, which are the big lines that take it from point of extraction to point of service, the distribution lines leak at our homes, and there's a study being done in Baltimore now, I think that's wrapped up, that I have heard is pretty similar to what this Boston study is showing, which is significant leakage at the distribution point in our neighborhoods. The important takeaway from this is that all of these structures leak. And when they leak, they don't just leak methane, they leak other materials that are, or chemicals that are also toxic. Next slide. And this is what we're wrapped into now. This is the extent of pipelines only, not compressor stations, in the United States. And look, if you will, on the Gulf Coast at the concentration in the area of Louisiana, which is until recently where we got most of our natural gas. And you'll see the convergence, if you will, of natural gas infrastructure. And now, since you've got your arrow, go on up to Cove Point area in Maryland. And we're going to talk about, now that we have an LNG facility on the coast of Maryland, we would expect to see the kind of convergence that you're seeing in the Gulf states. Next slide. And part of that is because of where we're located. And just in case you do not know, Cove Point has already started exporting. It's the second only facility in the United States that is exporting liquefied natural gas. And one of the things I'm going to talk about today is that there are two primary build-outs from natural gas right now. Liquefied natural gas being exported overseas, and plastics. Mm-hmm. They're producing more natural gas than they know what to do with. And those are two end uses that are finding some rapid attention right now. Next slide. So this is natural gas infrastructure in Maryland. And you're going to see the little, I don't know how easily you can see it, but these things that to me look like the cab of a little vehicle. They're yellow and black. Those are existing power plants or compressor stations in the state. If you went all the way over to the west to Garrett County, you'll see that there's one natural gas storage field. There's only one in the state. And then we're going to go back over to and look at some of the issues around some infrastructure that's currently being built or permitted. So the red are the pipelines that are already here. And if you look at the states around us, and if you think back to that national map, we're surrounded by the biggest producers of natural gas in the United States. Pennsylvania and West Virginia and a little bit in the Ohio area are, I think it's over 40% of all natural gas in the United States. So look over toward the Cove Point area and then look at what's all around us and think about the ways in which there's going to be pressure on our state to get that gas over to Cove Point. Next slide. These are some of the projects currently going on, and Kelly, since you're on, I'm not going to talk about Charles Compressor Station, but I do want to mention the Crane Peaker plant, which is a current, it's been it's out of use right now. It's a coal-fired plant that Public Service Commission is currently entertaining a proposal to convert to a gas-fired power plant. A peaker plant is a plant that handles intermittent service, or when you have peak demands. That's why it's called peaker. And what's important for you to know about this is that peaker plants are the most polluting of any gas plants and may be more polluting than a coal-fired plant, because most pollution occurs when you start a plant up and when you ramp it down. And a peaker plant is designed to do that because it's serving peak times. So it is, when it's in action, it is always being more polluting. And this is something we need to stop, and very concerned about that. Kelly, do you want to jump in and talk about Charles? I think I have a slide on Charles Compressor Station. If you can go down, next slide.
Yes. And I was just going to say, you anticipated my thinking. Kelly has a couple of slides after this, but also it's important to think about the fact that Baltimore is in the middle of a couple of these different issues. There are methane issues, which are a real trigger for climate change, and that's coming down the pike. And Baltimore is right in the middle of it, but fairly silent in the process around what's happening here. The idea that if you think about these plants as like the starting engine of a car, it's the trigger points are the same. And the fact that Baltimore is squarely in the middle of this suggests that it has a pretty big stake in talking about what the future of this work is going to look like and whether or not these are investments that we should be making for people's health. Kelly, do you want to jump in now, or do you want to jump in with the other slides? We can do both.
I'll let Amy finish.
Okay.
Okay, I'll just skip Charles and some of Dominion. So if you could go to the next slide.
Sure.
And then Kelly can talk about those. So this is just showing, I wanted to share this with you. This is a new mapping project that Sierra Club is doing. And I think that doing this sort of mapping that shows community impacts is one of the best ways to both do public education and to let legislators know the ways in which communities are connected and affected. So this is the existing pipeline that goes to Cove Point, and you'll see on there, you know, it's mapping state lands, which will be of some concern to some populations. It's also mapping existing facilities. And if you could go to the next slide, we're going to zero in on this. So this shows the public lands and where the original Charles Station would have been sited. But the next slide, well, let me just talk about one thing with this. So it's showing evacuation zones and high impact areas. And the difference between those is how hot it gets when these things blow up and how much you have to evacuate. And basically within the high impact area, you have the chance and likelihood of fatalities. So now go to the next slide, which I think is the most useful way to work with communities and legislators on this, is look at everything. Now this is a blown up part of this close to where the Charles Station would have been. And look at the number of daycare centers, hospitals, schools, nursing homes. Right over the pipeline. Some people don't even realize that these pipelines are underneath of them. This is something I learned with the accident storage field. There are people who lived out there who had no idea it was under where they lived. And I think this is the most important kind of mapping we can do to show communities where the impacts would be, and also for people to be able to think about evacuation zones. I know out here, the evacuation zone is right in the middle of where the disaster would be. There's no way you could get out on these rural roads. Next slide. So I tell you what, I may come back to this, but when you look at impacts at the local level, the way that the state and the federal government measure this, because I'm not sure Lynn is going to be able to get on the call, so I want to be sure to cover this. This is a slide that Lynn Zuzza prepared to show the importance of fence line monitoring. So the state and the feds measure ambient levels of air pollutants, air toxicants, and methane. They don't measure what happens at the level of facility. So if you think back to the slide you just saw of all those structures that are nearby pipelines and compressor stations, and then you consider those localized effects, and if you can go back to that graph again, the state looks at averages, some over 3 months, sometimes over a year. So if there are releases like that one spike, that's going to get averaged out to look like nothing. And this is the biggest issue with, I think, for communities, for all of us at looking at this air pollution in terms of the natural gas industry, is that's their requirement for reporting. They don't have to tell us when there are spikes. They don't have to tell us when they're doing releases. And it is those spikes that are probably the worst for our health. It's the cumulative effects of experiencing those emissions that are the worst for our health, and they don't have to report it. So an effort that's come out of communities that all of us, I think, are supporting is the demand that we have fence line monitoring, that's real-time monitoring of actual emissions that are of concern to public health, and that would be, you'd have a website you could go and see so that you could get your butt out of town if you needed to. This is what we're trying to do in Accident, Maryland. If they're going to have a blowdown, maybe that's not when you want to schedule your family picnic. They're going to do a blowdown that weekend. We ought to be able to get away from this stuff if and until they're going to stop emitting these levels. So next slide. It's another area of focus that we've been talking about in Maryland. This is the Eastern Panhandle Expansion Project that goes from Hancock, Maryland, which is up by the top circle, down to Jefferson County, West Virginia. And look at the amount of infrastructure already and existing in those areas. So this is a pipeline that has already been permitted and being built in West Virginia, permitted by most agencies in Maryland, but not yet being built. Next slide. The Eastern Panhandle part, the top arrow is where it would go through Hancock. And this is going to go down to an insulation plant in Jefferson County, West Virginia. And as far as we have all been able to determine, this is the sole purpose of this pipeline. So it's bringing Marcellus gas, fracked gas, out of Pennsylvania, where you see the red pipelines right at the border of Pennsylvania and West Virginia. It's tapping into that Marcellus gas. It's bringing it in through Maryland. It's about a 4-mile stretch in Maryland, unfortunately, going under the Potomac River, under the C&O Canal, and then down to Jefferson County for an insulation plant that I'd like to tell you a little bit more of what's involved with that, if I can find my notes on it. Rockwool produces a persistent material classified as partially carcinogenic to humans. What they do is they take chalk and rock, heat it up to around 3,000 degrees Fahrenheit, then blow a stream of air through it. Very similar, I kid you not, to the way you make cotton candy. Mm-hmm. It results in very thin fibers of rocky material that they then fuse with formaldehyde resins, highly toxic, and they use fossil fuels to melt the rock to be able to blow it and spin it. And it's highly toxic. I went on some gardening sites where they say, please don't put this in your soil. So this plant, and I want you to look at how close it is to Frederick, Maryland. It's about, 40 miles away. Would produce it's not only burning the methane and all the volatile organic compounds that are going to come off of burning methane at that plant and heating this product up with methane. It's also going to get the insulation manufacturing byproducts. And if you look at communities in Maryland, just look how close Rockwool plant is to the Maryland border. Right over where the P is in plant for Rockwool plant is Brunswick, Maryland. Frederick is the closest big town, but Gaithersburg and other towns are not that far away. Mm-hmm. All of which will be downwind of this. And that's such an important thing for us to all think about in these connections with pipelines and the compressor stations and the end product uses, whether it's a fertilizer plant or a plastics plant or an insulation plant, is that all of these are affecting our air, our water, and our soil, and they travel. They travel through food products, they travel through the water we drink, and the air, because most of the residents in Maryland are downwind of most of this infrastructure. Next slide. This is what's currently happening with the Eastern Panhandle Expansion Project. This is through Berkeley County. These homes are incredibly close. Tracy Cannon, who is working in this part of the world, has documented, I think she said 87 homes that are within the blast zone for the pipeline. Certainly these homes are both within the blast zone for the pipeline. So it's in West Virginia, and we'd have the same thing going through Maryland. Next slide. This is horizontal directional drilling equipment that will go under Sleepy Creek, which is a tributary for the Potomac in Berkeley County, West Virginia. Again, not very far from neighbors in Maryland. I want to tell you an interesting story about this horizontal directional drilling. This is going through karst geology. This is the Swiss cheese geology that rain, particularly acid rain, can cause the dissolving of dolomite and limestone so that you get these cavities. I don't have this substantiated yet, but a homeowner who lives nearby says that they have just drilled into a void under Sleepy Creek. And what happens when you drill into a void is all the drilling muds that you've been pushing out under high pressure in that pipe are going to just go extruded out everywhere into the void. And they have a failure with that pipeline. This is the technique they want to use to go under the Potomac River, also in an area of known karst geology. Next slide, please. This is just another picture of where the rock wool plant would be. It might also find it interesting as part of a bike path. They like to drill under areas that have already been cleared for other reasons, like power lines or bike paths. So you can be riding down in sunny, wonderful West Virginia in the mountains on a bike path and going over a pipeline and be in the blast zone for one. Next slide. I want you to know that there's a robust citizens effort to stop rock wool in West Virginia. And next slide, there's an opportunity for Marylanders to participate in West Virginia's Public Service Commission hearing. Actually, Tracy Cannon contacted them, and we do have Marylanders can comment. This will be commenting on the pipeline and the rock wool facility this week in Shepherdstown.
Yes, in 2 days.
So if you have an opportunity to get down there, again, people in Frederick are very close by, and I think the Sierra Club Eastern Panhandle Group is mobilizing for this as well. Next slide. Another threat on our horizon is the Delmarva pipeline. This is a 193-mile pipeline that goes from Delaware all the way to Northern Virginia. What I've heard is that's to be able to power chicken factories, but I don't have that substantiated. That's what I've heard. What I like about this frac tracker map is all of that green and blue underneath the red pipeline. That's all water features. It's streams, wetlands. I mean, you can't go on the eastern shore where they're thinking of putting this. And I also think about climate change, of what this will be like when sea level rises and you start having some of the saltwater incursions into aquifers below this pipeline. Next slide. There's a on-the-ground group, No Eastern Shore Pipeline, who are opposing this. This slide just gives you a sense of all the areas that would be affected, the amount of streams. It's an amazing place for anyone to think about putting a pipeline through, given the problems we're experiencing with the karst geology with the Eastern Panhandle pipeline. Next slide. Meanwhile, the current administration is fast-tracking this infrastructure. They did not robustly review the Eastern Panhandle project in the way that they could, and I'm sure that Delegate Lewis and Tamar are going to talk about the ways in which we can try to address that. They're talking about this conversion of a coal plant to a gas peaker, and to jumpstart frac gas pipelines throughout the state with a $1.3 million merger of AltGas and Washington Gas and Light. What also really concerns me about what the current administration is doing is that they're analyzing methane's global warming potential in a 100-year time frame, rather than looking at impacts in the near term. We don't have 100 years, and that may be something we can come back to and discuss later, but let's move on to the next slide. Tamara said about, earlier that we don't want zip codes to determine health. Check this out in terms of the counties that are most going to be affected by climate change. And I'm fortunately in a little green section, if it's hard to see on this map, in Maryland, Western Maryland. In fact, the only little green section in Maryland is where I live in Garrett County. Zip code, we're going to see a lot of climate migrants in this country. And you forget about what's going on in the world is astonishing in terms of climate migration. Climate migration is already happening in this country. People left the hurricanes in New Orleans and ended up in Houston and had to leave Houston. Look where folks are going to be going and look what's impacted. I think this is another way in which where we are, we're going to have significant climate impacts. And I'm just going to finish up with, I think my last slide is of accident, because I can't not quite talk about accident, our only storage field in the state of Maryland. Just want to show you, do you see those 3 white lines that go down the middle? Kind of like somebody took something and scratched down it. Those are methane level to ground level faults, geologic faults underneath the storage field. All those red lines are pipelines and injection wells. There's 78 of them out there. All of it on top of these geologic faults. And it's probably too small to see all the different structures, the schools and daycare facilities are on top of it. I think the whole thing's about 36 square miles. And it's a very old facility, and we have very little ability to affect what's happening with those old emissions. Again, we need the fence line monitoring, but I think I'll stop there. I've kind of thrown a lot out at once, and I'm happy to come back and talk about any of it later.
Sure. And do you want to say anything if Len is not going to join us? This is the full version of his poster on.
Do you want to tomorrow? Because you've been involved in it too.
Sure. So essentially, this is one poster presentation that was developed by a member of Community of Communities to go to the to a national convention for air quality sensor technology, specifically with the idea that we are no longer in the age where the science and technology are so expensive that we cannot possibly prove that harm is happening to people unless we spend lots of money through state agencies. As a part of Community of Communities work, we've been thinking a lot about how the same monitors that can be measuring pollution in particulate matter can be made to measure methane and other forms of harms for communities that are happening now in our now time frame. And if we don't have a $90,000 camp piece of equipment to be able to prove it, there are emerging technologies for as little as $20 for a sensor and some in between that can be made to form a network that is right near where people are, where the winds are going, and where the impacts are being felt. And together that can create a network of sensors that are able to pick up where the harms are, that if nothing else should be triggering a state agency to do its own investigation and to think more clearly about continuing to develop regulations that happen without the benefit of basic information about what's happening in the in-between. As Annie talked about, picking up a spike in a really expensive piece of equipment does nothing to tell you what that does to the community that's right near it when it's happening, or how often it happens, and what other things are happening in concert. Because if we measure these things in a vacuum, we will have information that is siloed as opposed to information that reflects how people are experiencing it. And so one of the things that we are thinking about is how the different communities that Annie has touched on could become places where the communities that are there can become sites for this kind of measurement in a network that reports back to the state agency, so that we are no longer in this blind spot that's hurting people. And that's a really great place for us to open up our conversation, to talk a little bit about how we got into this conversation as a group of people. Everyone on the call, if you haven't heard about it already, you haven't been around me in the last couple of years. I almost incessantly talk about Community of Communities. They are the fuel that helps me get up every morning and deal with it, because there are folks who are looking from their own stance as community experts, thinking about what's happening to them. They've joined forces to build defenses and demand protections through regulatory means and the political channels focused on health. They are focused on their own health, the health of their now families and their future generations that they are working to build, and they help me deal with just how heady all of this can be if you think about it all the time. These are just some of the communities that participate, and that list is growing every day. Folks who are involved in thinking about how natural gas infrastructure is impacting their health. I'll open it up for Kelly of Amps Creek Council to just talk a little bit about what she has been experiencing in her community. And I do have the videos keyed up. You just have to tell me which one and in what order you want to do that, Kelly.
Thanks, Tamara. So as Tamara said, I work with the Amp Creeks Council, which is the Accokeek, Mattawamem, Piscataway Creeks Communities Council. And our primary work is actually in Prince George's County, but it bleeds over into Charles County because we're very close. And of course, the water doesn't, and the communities around the water don't observe political lines in the sand. So about actually almost exactly to the day 2 years ago, plans were announced by Dominion to put a fracked gas compressor station in Charles County, right on the Prince George's County line, that would be connected to its Cove Point pipeline, which already exists, and would theoretically feed gas to two customers, and those would be the Mattawamem Energy Power Plant, which has not yet been fully permitted or approved for construction, but would be in Brandywine, Maryland, and would contribute to an enormous environmental injustice problem there. And then the second customer would be Washington Gas and Light. So there would be no gas coming to the area in which the compressor station would be built, the immediate area. And it's questionable really whether or not the gas would be going to those two customers. It is sort of an open secret that the gas would probably be going, at least in part, to the Cove Point export terminal, which is at the end of the pipeline. So what you see on the left side of your screen is the road on which the compressor station was proposed to be built, and on the right side of the screen, there's the actual driveway, and these are sort of the before pictures. What exists, I guess still exists, but what existed in 2016 was about 1.5 cleared acres, somewhat wooded, with it's just a small service facility. There's a pig launcher there, there's a little bit of administrative stuff, and there's some pipes out of the ground, but it's really something that people didn't notice. There's not noise that comes from there. There's nothing really happening. It's been around since the 70s and pretty inactive. Next slide. So in 2016, when this was announced, we began to do community organizing and try to mobilize people in the various ways to contact the various agencies and set up for lawsuits. And so what you see on the left is a community event that we organized called Spaghetti Outta Here. It was a spaghetti dinner where we had people come and submit comments online to FERC, the Federal Energy Regulatory Commission. And we had technology set up, and my son went around and helped people who were having trouble, and we had sheets that people could use as cheat sheets to submit their comments. So that went really well. But at that point in time, people still kind of had the idea that the government would protect them, and that maybe this wasn't as bad as people were making it out to be, and that probably there was some alarmist behavior going on. And then a couple of things happened. One, on the right, you see a huge plume of smoke. So that is actually coming from an outbuilding at my parents' house. That happened on the day that the FERC comments were due. It was December 21st in 2016. And that plume was visible to my dad, who was 20 minutes away in Waldorf, before he knew that that was at my parents' house, rather. He saw the plume of smoke. It was that big. So my parents live about a mile, 3/4 of a mile from the compressor station. There's just one property in between them and the proposed site. Next slide. And you see there on the right, the fire starting to overtake outbuildings. And eventually what happened is everything there burned to the ground completely, because what happens in this area, it's a rural area, is that firefighters can't get water to fires, and rather than trying to save structures, what they try to do is just prevent the fire from moving into the woods. So they lost a lot of everything. And that really like snapped people into attention. And during the process that we've been fighting this compressor station, there were actually, I think, 4 more fires that happened. And one of them, the one that was closest to the Dominion compressor station proposed site, there was a fatality involved. A man named Dwayne Chris Bell was killed with his dog. And that also was closer to the fire station and closer to a fire hydrant than the fire at my parents' house. So what that really did was focus people on what might happen if a fire did occur at the compressor station site. And we know, of course, that at compressor station sites, fires are more common even than they are at other parts of the pipeline. And so people started to get really, really frightened and alarmed, and of course, catalyzed to action. Next slide.
So what I was going to ask, if I could, Kelly, is what does this do to a community? I think it has to be, it's really commendable that you were able to spring into action and to get a community to start doing something. But what does it feel like to have, like, just seeing a fire raging out of control can be really debilitating for folks?
It is.
And
this is definitely what I'm jumping to. So there was this one, and then the others also were all within a 2-mile radius of the compressor station proposed site. And people began to just get terrified. And so there was the fire issue, and then there was a flooding issue also. And so what people realized through this process was, number one, that the government was not going to protect them, because their interactions with the government and state agencies and federal agencies was horrible. And they started to realize that actually they weren't going to get the reaction that they thought they were going to, no matter how many letters they sent, and no matter whether or not they signed a petition or made a phone call, this thing was still moving forward. And people started thinking, maybe we shouldn't live here. Maybe it's time to put our houses on the market before things go forward. And I do know 2 families who moved proactively, as it were, before this was put in. But it definitely put a lot of strain on families as well, people trying to decide how to react to this, what to do, whether they could reasonably move or not. Some people, of course, don't have the money to just pick up and go, the ability to do that. They need to stay here for family or other reasons. But it's really, really frightening. And so, can we do the next slide?
Sure.
So there was this fire issue, and then that was compounded by, I think it's the videos are what I want to go to.
Okay. Do you want to, which one? There's this one. And there's this one.
Oh, I can't see it.
Oh.
I can summarize in any case. So there has long been the road on which the compressor station would have been built is prone to flooding. There are wetlands everywhere on that road, and it was unbelievable to people that this was even proposed for that site, because the ground is so marshy. There is a great big swamp there, and a lot of waterways going through the property and around it, and it's very close to the Potomac River. And so people kept saying, there's no way this thing could even go forward, it won't perk, you know, they can't build with these wetlands, there's no chance it'll go forward. And then it did start to move forward, and people got more and more frightened. Oh my God, they're not protecting us, oh my God. You know, we know what the soil is like there, we know it's this clay, you know, we've lived here for however many years, we've walked that property. We know how it floods. And yet Dominion is saying that there's magically, right where they want to build this thing, a 14-acre spot where there's just no flooding, there are no wetlands, there are no waterways, and ta-da, there it is. And everyone knows that that's just, you know, potentially wishful thinking. I mean,
that was
just
very diplomatic of you.
It seems inconceivable, frankly. And yet it was moving forward. And so people started to freak out. And so were organizing, but began to sort of start hedging their bets because they were so frightened. Some people just shut down. Some people couldn't do it. They couldn't deal with what might be coming down the pike. Some people thought, we've got to get out of here. There were some people who were like energized and like, we'll get it, we can win this. But there were other people who thought, we've got to hedge our bets and we're going to start organizing however we can, and maybe we think this person isn't doing it right, so we're going to go against them and go the other way. And it started to cause like fractures in the community about how to fight this thing. And it started to really pull people apart. You know, it was straining longtime friendships and family relationships. And just the stress was unbelievable. People couldn't sleep. People were crying all the time. People were coming to hearings and just sort of breaking down. Can we go to the hearing pictures tomorrow?
Yeah. Let me see if we might be having a technical difficulty with that one.
Oh, that's okay. I can just explain what they are. So there, one of the photos is of a gentleman who's standing in front of a screen, and he's pointing at the screen, which has maps on it. And there are two guys there from Dominion who are watching him. And he was just breaking down, and it was horrible. It was a Maryland Department of the Environment hearing, and he was just breaking down. He's saying, my property is right here on this thing, and you're telling me that this isn't going to affect my property. I know it's going to affect my property. I know what you're telling me. And just absolutely melting down. And the people around him also just absolutely melting down because nobody was listening. And they were saying, well, but the rules say this and the rules say that. And we're going, the rules can just take a hike. They're not protecting us. And again, like just the massive turnout, you know, all kinds of folks, people from young to old and all, you know, spectrums of the demographics that you can come up with. Everybody was turning out for these things, just really freaking out about what might happen. And then to make matters worse, better and worse maybe, not very long ago, the Mount Vernon Ladies Association jumped into the game, and it's unclear why they jumped into the game at this point, but they did, and they began to have closed-door meetings with Dominion. And Dominion began to say, well, maybe we could look for another site. Maybe we could consider putting this thing somewhere else. But they won't say, you know, where they're considering. So nobody knows what the possible sites are. They can sort of guess, but don't really know. No one was allowed to be a part of the meetings. So you've got the Mount Vernon folks in Virginia and the Dominion folks also in Virginia behind closed doors, you know, in their 1% rooms, discussing what's going to happen to us here. And what's going to happen to us here impacts what happens to the folks in Brandywine if that power plant gets built. It impacts what happens to the folks in Cove Point if more gas is getting pushed towards them. And it happens to everybody along the pipeline if stuff is coming through at a higher pressure and then it's prone to explosion. And so recently, some strange equipment came on site, was spotted on site at the proposed compressor station site. And so what it looked like is these big trucks with sort of weird HVAC equipment on it. There were like 3 chambers, and nobody knew what it was. And so you know, people started calling and saying like, what is this? What's happening? And so I went over to the site and just asked. And I got sick right away because there was so much gas coming from the site, and I was just like nauseous and ill and dizzy. But there were a couple of guys there, and I said, hey, you know, people are really worried about what's going on. Can you tell me what's happening here? And they said, sure. We're contractors. Dominion hired us to do this work on the pipeline. And they said, this is a portable compressor station. So what we're doing is, you know, there's a looped pipeline right here, and that means two parallel pipelines that merge from, they come from one pipeline, they split into two, and then they merge back together a couple miles later. It's a way of adding capacity to a pipeline. So they were cutting into one pipeline and then feeding the gas through this portable compressor station and then into the other pipeline, and then doing intermittent blowdowns where they were shooting a huge amount of gas into the air, but not telling anyone. So people were going outside, smelling gas, getting sick, going by the site, seeing things happen, not knowing what was going on. They didn't know who to call. They didn't know what to do. And so somebody figured out what the MDE emergency services number was. And so we began spreading that around, and people would call. And their answer was like, it's routine pipeline maintenance. We really don't know much about it. You can call PHMSA, the federal agency that oversees this. And so we called them, and they said, well, you should call 911. And so we said, okay. So we called 911, and there's a backstory to that I don't have time to get into, but the fire station apparently showed up and said, oh, it seems like things are fine, but based on what, we have no idea. And PHMSA said, well, we don't really know what's going on there. It's routine pipeline maintenance. They don't have to tell us. And also, we only have 10 inspectors for the entire Eastern Seaboard. So we're going to try to get one there the next time they do a blowdown, but we don't know if they'll get there. And I said, okay, can you just tell me when the next blowdown is going to be so I can alert the community, since Dominion refuses to do it, and then people won't be so frightened, and, you know, maybe they won't go outside. And he said, well, we don't really know when it's going to be. And I said, well, how are you going to have an inspector there if you don't know what it's going to be? That's going to be kind of tough to time, don't you think? And he said, yeah, it is going to be tough to time. And it was literally all they had for us. So then people are just terrified about this, just terrified. And so finally Dominion announced that that they were going to change sites, that this site was not going to be it, and they were going to go somewhere else. And so people are celebrating, hooray, hooray, this is wonderful, we've won this part of the fight, but it's still, they're saying it's not going to go away, it's just going to go somewhere else. Well, immediately on the Prince George's County side of the pipeline, there's this tiny service station that no one noticed, no one realized it was there, and all of a sudden there are 3 of these portable compressor station trucks parked there with Texas license plates and a Texas company tag on the side, and they start doing exactly what they did at the first site, digging into the ground, cutting into the pipeline. And one thing that we were told, that PHMSA told us, was that Dominion had decided that in order not to alarm the public, they were going to mask the smell of the gas by making it smell like oranges, like citrus. So if people went outside and got sick, they wouldn't even know. They wouldn't have any idea what was causing it. If there was a big leak, they wouldn't even have any way to report it. They wouldn't know what was going on. They'd just say like, wow, that's weird, we smell citrus. And so once we knew that and shared that with people, it was enormously stressful to say, if something goes wrong here, how do we even know to tell someone? How do we even know to move away from the problem if they're deliberately masking the smell? And we said, could you tell them to please not mask the smell? Could you tell them to please make it smell bad so we know? And they said, no, we can't do that. There's no rule that they can't do that. So no, we can't. And then the people near the Prince George's County side, where there is a denser population, where there are more houses around it, where it was literally like almost hitting the the parking lot of a church. There are daycare centers there. Those people start getting really frightened. They don't know what's going on. They're going, what is this stuff happening over here? Is it moving here? Is that why they're cutting into the pipeline? Are they checking? And so there's just like enormous community stress again. there's the joy over the victory that it won't be in this one location, but then the terror about where it's going to be and what's going to happen. And since they're being so secretive about the entire process, how we get involved and how we get notification and what we do to monitor it. And so that's just, I just wanted to share a little bit about the mental health impacts that all of this has on people, because they are enormous. It is a lot to live with this. In the 2 years that this has been going on, people have just been falling apart.
And this is, Kelly, I just want to thank you. I'm sorry I had to cut you there.
No.
I just wanted to thank you for honestly talking about what's happening in your community and helping to draw a line around it. So much of what you said dovetailed with what Annie mentioned around blowdowns. Like, that word is very neat, but what it is talking about is a very messy project that is ongoing. And if there are fires raging in a community at the same time, and one part of a community, and gas being flown into the air in another part of the community, it isn't very difficult to imagine that the two meeting could be disastrous for a community that does not have a set evacuation route. So just in this hour of discussion, we have talked about a lack of regulations and processes that give people an opportunity to get out of known dangers. You just highlighted a whole bunch of unknown dangers and the terror that happens to a community that is not involved in the planning, is not involved in even knowing that a thing is happening. And even when wind happens, like has recently happened in Charles County, it's only one of several parts of this that your community is dealing with. And I am personally very grateful, as someone who's thinking about this work as a piece, that your community has decided that they will continue to stay in the conversation around where this goes. So you're not saying, yay, we have managed to stop this compressor station from showing up in our backyard. Looking forward to see where it ends up. The first thing that you did was put out a statement saying that wherever it goes, you will join with that community to be able to deal with what happens. And given that the communities of color and communities of people who are underrepresented because they don't have status or they don't have money, this is an important set of alliances that really goes to the heart of what we can do to have some hope, as all of this, the morass of unintentional consequences and intentional lack of clarity, put communities in a situation where they are fighting an unseen enemy with tons of tentacles that they are not invited to even discuss, much less know about. But do you want to add anything else to that? I thought it was just incredible for you to talk about the terror, the campaign of terror that accompanies this kind of decision making.
Thank you, and I want to appreciate you for phrasing everything so eloquently. There is one number that I would really like to leave people with, and that is that for this project, Dominion put in their application this number. They said that approximately 100 times per year, there would be a startup, a shutdown, or a blowdown, a planned blowdown at the compressor station. So that didn't count unplanned events, and that was an approximation, which means that there certainly could have been more, but that's almost a third of the days of the year. And Annie did a really good job of talking about how those are the times when there is the most extreme pollution. There's this giant burst of gas shot into the air, and it doesn't go through exhaust, it doesn't go through filters at that point. It's just coming straight from the pipe into the air. And you can imagine what that would do to people, not only the noise, but also the pollution and the attending health impacts that would have, both mental and physical. And these would be, just in case anybody on the call is not clear, in predominantly African-American communities, both where it was proposed and where it would end up, because this is a predominantly African-American area. Also with large populations of other folks who are not white folks. So Piscataway folks, Latinx folks, Asian Pacific Islander folks. We are a very diverse community here. And so absolutely folks who have been traditionally marginalized and who tend to get stuck with this kind of junk in their backyards. that's really what Dominion is trying to do, is stick these people with this awful project again.
Well, again, I thank you for being so brave as to be completely honest, to talk to us about what's happening in your community and to serve as a real example of what happens when we keep communities together. It's why social cohesion is so important. It isn't just that it takes away one of your problems, which is that you're isolated and alone, but that by doing things together, you can create a full picture of the harm, which really empowers willing advocates like the Delegate and others to think about how it is we can go about going from a void of information to more room for conversation. And I'd like to invite her in right now to discuss one of the proposals that we have been championing. She has championed for the last year and will again this year. And I'll just put a little wrapper on it by talking about the concept, health impact assessments. A health impact assessment doesn't solve everything that's wrong in the world, but one thing it does do to respond to some of the issues that Annie and Kelly mentioned is that it helps to define a problem. It helps to say that a policy, a program, or a project may have impacts on the health of a population. That could be something just as, that could be air quality impacts, it could be threats to water, but it could also be the local threat to people's mental health proposed by these activities happening in rapid succession and without a community discussion. So what the Delegate proposed this last year was a rapid health impact assessment, and I'll pause here to ask you if you would like to talk a little bit more about that, Delegate Lewis. Thank you for joining us today.
Yes, thank you, Tamara. Thank you to the two previous speakers for laying the groundwork for a conversation about health impact assessments. Especially want to commend you, Kelly, for talking clearly and honestly about what it feels like to be in the middle of a firestorm, literally, around your environmental safety. And that's really important and good for people like me to keep in mind. So a health impact assessment is an evaluation tool. It's a decision-making tool. It is used to gather information about the potential impacts on human health for large-scale projects that involve land use and potential changes to the built environment. They can also include other types of projects, but in the context of this conversation, a health impact assessment would look at impacts on air, water, soil, physical health, mental well-being, and any other indicator for human well-being that we can measure. And it would gather that information and use it to answer the question, is this project, this intervention, this effort worth doing if it harms human health? So a health impact assessment, which I will from here forward refer to as HIAs, are used around the world. The World Health Organization has codified the health impact assessment as a meaningful tool. You can read the definition here. There are governments around the world, in Europe and in other places, I think in some places like in Asia, I believe they've been used in Australia and certainly in Canada, as policy decision-making tools and mechanisms for deciding whether or not to spend public resources on any kind of project or effort. So, that said, you won't be surprised to know that in the United States, health impact assessments, HIAs, aren't used that widely. And as best I'm aware, and Tamara, correct me if I'm wrong, nowhere in this country are HIAs used at the state level to determine the use of public resources for infrastructure projects.
That's correct. And it's strange given how successful the model is and how it straddles other similar policies, but with a specific emphasis on human health.
Right. And that's a good point. Some of you may be familiar with an evaluation tool called the Environmental Impact Assessment, the EIA. Environmental impact assessments are federally required for large-scale infrastructure projects like highways. An EIA is a mandate that comes down through the, well, at least until recently. But anyway, the Environmental Protection Agency would work with localities to carry out and codify and implement EIAs as a condition of moving forward on huge infrastructure. Mm-hmm. We don't have anything like that asking the question about health impacts other than the HIA, and we're not using them. So we have an opportunity. I will say that before I became a delegate a year and a half ago, other state legislators did attempt to use HIA in policy making, but they were not successful. So working very closely with Tamara and the Maryland Environmental Health Network, we developed a draft piece of legislation to require the use of HIAs in decision making for energy permitting projects. So you'll see on your screen here a quick summary of, House Bill 1632. Thanks. We introduced this bill last year. We're going to try again this year, maybe with some tweaks.
Yep.
The idea is this. We propose that before the Public Service Commission of Maryland, the PSC, approves any permitting for natural gas infrastructure project, a health impact assessment must be performed, and those results must be used to make a determination about the feasibility of that infrastructure, that natural gas infrastructure project. So, so that was the bill. And we did get a hearing, which was major. Mm-hmm. They don't have to give you even a hearing, but we did have the opportunity to be heard, to bring panelists and testimony forward at the Committee of Jurisdiction, which was Economic Matters. It's a regulatory committee. And we were not successful in getting the bill passed, but we did get a hearing, and that's a great first step. One of the things we know about HIAs is that they are useful not only for policymakers, but for community members. An HIA is a participatory technique for research. It engages, it actively involves input from affected human beings and uses their observations, their stories, their testimony to build the evidence for potential health impacts. So that's really important, and it would respond, for example, to a situation like Kelly described. I think an important reference is here in the second bullet on this slide. HIAs are founded on the values of democracy, equity, and sustainable development, and the ethical use of evidence. One thing that we're missing in decision-making about large infrastructure projects in general, and energy projects in particular, is a democratic and equitable decision-making process. So HIAs would introduce that opportunity for democracy, equity, etc. Next slide. And I think, Tamara, I would invite you at this point to add anything I might have left out.
I think one thing that's exciting about taking this on is that it highlights, as you pointed out, that an environmental impact assessment or an environmental assessment comes with a lot of assumptions. People who would see good done, who show up every day in the legislature because they care about their communities, presume that we are already looking at human health. You are also a part of the Health and All Policies Commission, which with Senator Nathan Pulliam, and its specific mandate is to think about the fact that we presume that human health is considered all over the place, and we are wrong every time. While we have legislation and regulations and statewide policy that looks at whether or not the aesthetic value is being injured, which Kelly spoke to a little bit when she talked about how after 12 different hearings, a closed door meeting about the aesthetic value of putting a compressor station in view of George Washington's view of the Potomac is what's protected her community. That's not an accidental thing. It's because the power of protecting the optics of something is more important than people's human health. And it's not because as human beings sitting around making policy, we don't care about our health. It's because we assume it's built in. We assume if we look at air quality, then we are considering what that air quality does to people, and we are wrong. We look at water quality, and we presume that that automatically speaks to safe drinking water, whether or not water is fishable and swimmable. None of those things are true unless communities speak up with legislative champions that support them to build in that kind of reflectiveness. Because just saying the air quality is X just means that you may or may not be triggered if you have asthma, that you may or may not be triggered if you have COPD, that if you are someone who is a likely candidate for cardiac issues, that you may be caused some triggering event that could end your life well before it's natural for you. And so this particular intervention is an elegant solution to doing what everybody assumes we're already doing. And if we're successful at the level of the Public Service Commission, where so much of statewide energy choice is being decided simply by bringing up the idea that robots are not building this stuff to serve the need of other robots. We should be considering the health impacts of the human beings who are local, the human beings who are supposed to be served by this stuff, and the people who are supposed to appreciate all this money that's coming in. If we are not actually looking at people's health, none of those things will come into play. So I have to say, as a professional and as the leader of the Maryland Environmental Health Network and a member of Community of Communities, it is a huge grant of gratitude that we owe you for reinserting human health into a conversation about what we're doing with our investments in the state of Maryland.
Absolutely.
And
that's why we're here.
And at this time, I will open up the microphones in case there are questions from other folks in the conversation. We have a robust number of folks on the line, and you'll notice that you are being free to talk. So if you have any questions for our panelists or for the delegate, please do jump in and ask questions on either the health policy or the community involvement that has created a space for us to think more clearly. I'll give a little bit of background while we cue that up to let folks know that this particular piece of legislation was sponsored and is brought by the delegate, but was considered and brought to the fore by communities who recognize that this is a place where their needs are not being met, where there's no space to build in a conversation around human health, particularly if communities are only welcomed in after the fact, once a thing has been decided for a very small window of time to comment on a thing that's already scheduled to happen. So I'll open it up for either the panelists or anybody else on the call to ask any questions of one another.
I just wanted to throw something in because I neglected to talk about it earlier, but this infrastructure is also very dangerous for workers. We know some of the research on people who are extracting natural gas. It's one of the highest rates of death and injury for American workers. Pipelines are almost up there with it, the construction of pipelines. And the Bureau of Labor Statistics does not even keep track of pipeline deaths and injuries. And I wondered when Kelly went out to the work site where you all smelled that, if the workers had any ventilation equipment on.
They didn't, which was shocking to me. But to also to speak to something that you just said, Annie, during the 12 hearings that we had before the Charles County Board of Appeals for Dominion's zoning special exception application, we think that the thing that had possibly the biggest impact on the board, because they kept returning to it again and again, was a video that we put together. My son actually edited together for me. And what we did was we found video of explosions of compressor stations and just edited clip after clip after clip after clip together and showed it to the board. This is what it actually looks like when a compressor station blows up. It happens enough that we have this many videos of it just from a very quick search and just threw this together. And in one of them in particular that was terrifying, you could see people running. as the explosion was like racing towards them. They're like running and diving on the ground, and it was, you know, it was awful. So yeah.
Wow. I think it's such a it's important for us to be talking to one another across the state, because the future of this work is that if the pipelines that are just the ones that are proposed happen, then this will incorporate everybody in the state. People will either live near a compressor station or a pipeline or a well pad. There are not any parts of the way that this folds out that leaves anybody an exception. Of all the things that we worry about as folks in this state, are you guys noticing that folks are seeing this as a threat across your community and in other places where you're going? Because Community of Communities does bring together a good number of people who don't live anywhere near each other but are bound by this one thing. So it'd be interesting to hear if you feel like it is useful to be talking to other people in the state who may not have had a compressor station yet, or who may have already had one installed, and where their experiences have taken them.
I cannot say yes enough. Oh my God, yes. Being able to talk to people who have either gone through this before or who have been going through it. And this is, you know, even though like we spent years fighting the export terminal and getting involved in fights in Pennsylvania and Virginia and other places with these frac gas infrastructure that would be feeding Maryland and you know, but even so, when it came to this one particular piece of infrastructure, being able to talk, to example, to people from Myersville, being able to talk to people in Community of Communities, being able to go to people in Virginia and other places and talk to them about their experiences, absolutely invaluable. And just to realize, you know, and to be able to show it to people who haven't been fighting it for years, who are coming to this, you know, new and scared, and say, look, we know a lot. We're not actually coming into this cold. We have this institutional knowledge. We just need to tap into it. And that means a lot.
Well, Annie?
Yeah, agreed. And that what we want to do, you would not believe how much time we all spend on the phone with each other or going to each other's hearings, and how much we've learned. And we do want to institutionalize that, so it's easier for people to tap into it, because the way the playbook industry has is to come in and schmooze some locals and promise fire trucks and ball fields and get a site selected before they have to have the site before they put in the permit. So the site has been selected before we even know about it. So there's a lot we have learned. And by the way, I'm hearing that they're eminent domain landmen talking eminent domain on the Delmarva area too. So we need to get in early and help communities so that you don't go through the same stuff that a lot of other communities have gone through.
Well, I thank each of you for taking the time to think about this, for showing up as yourselves, and for working across the work so that we can develop real solutions for communities. I will check just to see if you are shy. Sometimes we get folks on the webinar who aren't ready for their 15 minutes of fame. And so if you feel like you want to ask a question of one of our panelists, do feel free to send me a note in the chat box, and I'm happy to read your question to folks. In the meantime, I will thank each of you, Kelly, Ann, and Delegate Lewis, for your time and energy and for all of the hours you spend thinking about this when the rest of us are sleeping. I learned a long time ago watching a documentary from Madonna that work is what happens when everyone else is eating macaroni and cheese. So I appreciate you for taking the time to think about this complicated subject matter and break it down to the level where people can experience it. I am providing on this screen, you will find there are a number of resources on what a health impact assessment is, from the World Health Organization, from Centers for Disease Control, from the EPA or what's left of it. And from our partners, there are also some really great long form papers on how it's being used, and a study from Connecticut that we are currently in the process of thinking about, which even breaks down what kinds of assessment, where policy makes sense to add an assessment and where it does not. I've also noted that somebody has just popped up with with a question, so I will read in the chat box and see what it says. Yes, from Mr. Arjun Makajani, a huge friend of the family. Does the HIA bill give leverage to people to go to court if the HIA is inadequate? Delegate Lewis?
That's a really good question. No, the bill as it's currently written does not empower any sort of lawsuit. And this is the secret to successful legislation. It focuses on one thing. All this bill does is require a state agency, the PSC, to mandate and consider findings of an HIA for any energy infrastructure project that it permits. That's all the bill does. If we tried to make it do more than that, we'd have even more trouble than we already have. I would defer to Tamara, who's an attorney, as to what mechanisms might be possible to build in some kind of, a stick in addition to the carrot. I mean, people, this is America and anyone can sue anyone anytime they want, I suppose. I believe that if this bill, if we're able to get some legislation to require the state agency to conduct HIAs, I think a whole body of legal work would flow from that. But I'll turn it to the attorney on the call to answer that question.
Well, one thing that I'll say, and just to underscore what the delegate has said, is that yes, to get a health impact assessment, to get a basic thing that we assume is happening, to get that happening, we would already open up a door, because just by being able to create a set of baseline assessments of community health, it sets a precedent. The Public Service Commission is fairly small relative to other agencies, even though it has an outsized impact. So in order for us to get a win at the Public Service Commission, that would serve as a really important example of how doing something that you can do in 45 days to include communities in a conversation about what their health looks like is a precedent we should be setting. If it works there, why would we stop? Why wouldn't we talk to MDE? Why wouldn't we talk to the Department of Natural Resources? And by doing it and showing that it works and that it isn't an excessive burden, one thing that the delegate was modest in not pointing out is that the price tag for this action was $0. And so of all of the legislative proposals that people bang their heads against the wall saying, this is just another way to expand government, we're going to destroy any resources that we have, the price tag for finding out whether or not you are destroying the future of people who are impacted by statewide energy choice is nothing. Because the group that files for the permit the same way that they would for an environmental impact assessment or an environmental assessment, which is a much shorter version of that, they foot the bill for doing basic research to pull the state's information on whether people are already sick or whether they are likely to be sick, whether they have conditions that could be exacerbated by it. And following that, you then have a baseline for where the community's health was before a thing happened, which would be a really useful tool if you are going to make the argument that a community has been injured by activity. So yes, in a world where we're looking at how a federal environmental impact assessment automatically has a trigger, this does not do that, but it sets a framework in place where once you prove a harm, you can argue for it. I think if we were to add something later on, once this was successful, that might be a next step that would be useful in considering, but there are also other things on the table for this session, including a constitutional amendment, the Maryland Green Amendment, which would create a right to be sued if you are damaging the future enjoyment of Marylanders to enjoy the air quality and the water. So while this particular piece does not do that, because its role is to bring in human health into the conversation, there are other pieces of complementary legislation happening at this time, and which would be Maryland specific and inside of the Constitution of Maryland, right up there with freedom of speech and freedom of assembly, that together could be an incredibly powerful way to get this work done. So we don't want to, what we're trying to do is work an inside and outside strategy, because the federal government should already be providing us with this kind of protection. So as we watch the federal government fail us, we are standing up in our state to ask for more protections. But thanks so much, Arjun, for like just another excellent question and a great way to think about what we're doing. I'm going to read a note to all the panelists in case you haven't seen it from Linda. She says, we are listening. Those of us who are residents in the middle of nowhere, accident and gasland, cannot thank you enough. Thank you for helping us. So just so you are aware, this is a team effort, and everyone who's on this call, whether you are a panelist or not, we will require of you your own voice to talk about how this impacts you when this bill gets back on the floor, because the delegate can be an excellent cheerleader, but if she doesn't have volumes of people behind her saying that this matters to them, that this would change them, lots of things can happen to make it so that her intentions are not the outcome. And so we have to be supportive of champions who are pushing for things that really help us. So if you don't feel like you can stand up and give testimony, you can write a postcard, you can make a phone call. There are things you can do to actively support the success of this, because there's no hard rule that says it takes 3 years to get good work done. That's just how long it takes to get everybody to realize that it impacts them. Why don't we break that stereotype and get it done next year?
Right.
Thank you. Absolutely.
And on that note, I will close us out by just thanking everybody and letting you know that if you want to see the presentations from our previous briefings on community solar, on the state of renewable energy in the state of Maryland, on the Maryland Green Amendment, which will be a huge partner if they both pass, we are recorded it on our website, and we'll be posting up all of these briefings on our YouTube at the end of the last one. So just before December, you'll be able to have 90 minutes on each one of these topics, and you can use them at your disposal. The next briefing will happen on November 5th at noon, and it'll be on water quality and community health, hosted by Clean Water Action and Water Keepers Chesapeake. Thanks so much to everybody for your participation and your attention, and stay in community with us, because we can't do any of this without you.
Thank you. Thank you.
Thanks, Dr. Lewis.
Thank you all.
Bye-bye.
Bye.